Agwineshla Korja, my name is Miriam Cunningham. I'd like to thank you for participating in the seventh in a series of best practice lectures organised by IEEE Humanitarian Technology Board Ad Hoc Committee on Site Best Practices in cooperation with a number of IEEE OUs, including IEEE SSIT IST Africa Site, IEEE Philadelphia Section Site, IEEE Bahrain Section Site, IEEE Karachi Site, IEEE UK and Ireland SSIT Chapter, and Region 8 Committee on Climate Change. Agwinusha Korja, my name is Miriam Cunningham. I'm based in Ireland. I'm a senior consultant with over 25 years' experience in ICT research and innovation, working with public, private, education and research stakeholders in Europe and Africa. In the context of IST Africa, I've been working in strategic partnership with African ministries in 18 African member states responsible for science, technology, innovation and research to support technology adoption, build research, innovation and entrepreneurship capacity, and support scientific collaboration among relevant national research and innovation actors over the past 18 years. I have extensive experience as both a principal investigator on a portfolio of large-scale digital technology innovation-orientated cross-border projects in Europe and Africa, as a practitioner working in low-resource environments, and as a technology expert with the European Commission evaluating research proposals and monitoring funded projects. I'm an active IEEE volunteer with several leadership roles. I'm an appointed member of the IEEE Humanitarian Technologies Board, chairing the Ad Hoc Committee on Site Best Practices, an elected member of the Board of Governors of the IEEE Society on Societal Implications of Technology, chair of the IEEE UK and Ireland SSIT Chapter, a co-founder of the IEEE SSIT IST Africa site, and I'm an SSIT Distinguished Lecturer. Today, I'd like to share insights into the motivation, methodology, functionality, lessons learned, and good practices from Health4Afrika. Based on our long-term strategic relationship with national governments across Africa, we identified that a key concern from their perspective was to leverage technology to strengthen universal healthcare delivery. In the context of the UN Sustainable Development Goal 3, governments around the world are working towards strengthening the impact of, as well as increasing access to healthcare delivery. Coherent strategies and enabling regulatory environments are required to support universal access to patient-centric healthcare delivery. Equally importantly, skills development programs, including digital literacy, are required to provide the necessary foundational capacity to facilitate complementing available existing medical expertise with appropriate health-related technology. If technology is to be widely adopted, the minimum requirement is an appropriate electronic health record. Despite progress made across Africa, Caribbean, and Pacific Group countries in introducing electronic patient records in large urban hospitals, paper-based registries are still the default data capture method in most primary healthcare facilities, particularly in Africa. Unfortunately, many of the health technology solutions introduced by donors in recent years have tended to address the specific program they're funding, such as ART for HIV/AIDS or TB, for example. Few e-health or mHealth solutions to date have adopted a holistic approach to patient-centric care or reflect the range of necessary services provided to local communities. There is now an increasing realization that using siloed e-health or mHealth solutions is not sustainable, as they tend to have a negative impact on the overall continuum of care, wasting scarce resources through data fragmentation and duplication of effort. Health4Afrika secured funding from Horizon 2020, the European Commission Research and Innovation Framework Programme. Our objective was to co-design a comprehensive patient-centric health platform for use in resource-constrained environments around the world. Designed to be adaptive and extensible, modular and multilingual, Health4Afrika integrates electronic health and medical records functionality with the use of medical sensors at the point of care, data visualization and data support tools. It also supports automatic counting of aggregate program indicator data required by ministries of health, as well as SMS notification reminders. An integration was also undertaken with a system designed to streamline laboratory tests for clinical patients. The objective of Health4Afrika is to strengthen healthcare delivery in resource-constrained environments by replacing on a staged basis both hard copy patient registries and any siloed or program-specific electronic health solutions currently in use. Health4Afrika worked in partnership with ministries of health, district health offices, clinical managers and nurses in healthcare facilities in Ethiopia, Kenya, Malawi and South Africa to inform required functionality, workflow and usability requirements. Our approach to supporting sustainability is based on building local capacity through collaboration with local university partners. Health4Afrika aims to assist healthcare facilities to increase the quality and impact of care by strengthening the capacity of healthcare workers to diagnose and treat patients, to make it easy to both capture comprehensive medical histories and current medical conditions, and identify potential trends or risks based on previous visits to support continuity of care and follow-up. Health4Afrika supports a prevention-focused healthcare strategy by focusing on leveraging appropriate technology to strengthen community trust in healthcare delivery, to encourage greater frequency of contact across all healthcare needs, supported by community healthcare workers. It can save valuable clinical time at health facility level through automating the aggregation of program indicator data, while supporting strengthening of decision-making and policy formulation by significantly increasing the accuracy of this critical resource used by district health offices and ministries of health. Health4Afrika aims to strengthen clinical and diagnostic skills at healthcare facility level by facilitating online access to critical educational materials from nursing and medical schools. When developing Health4Afrika, collaborative open innovation and design science research techniques and an agile development process were applied. Necessary ethical approval was secured in each country. We worked closely with policymakers, district health offices, clinic managers and healthcare workers to co-design and validate a number of iterations of the Health4Afrika platform. This iterative consultation-based approach helped accelerate both prioritizing and incrementally refining program-related datasets, necessary functionality, workflow, and usability issues. Qualitative data collection and ethnographic observation techniques were used during the needs requirements, baseline study, and platform validation phases. While addressing the mandatory program-related data required for use in Ethiopia, Kenya, Malawi, and South Africa, when implementing the medical programs such as maternal, child under 5, TB, ART, etc., Health4Afrika was co-designed from a cross-border perspective. By building Health4Afrika around a superset of data points, incorporating national and cross-border requirements, this can be easily extended to facilitate adaptation and adoption by other countries across Africa as well as around the world. Initial intervention health facilities in northern Ethiopia, western Kenya, southern Malawi, and Eastern Cape, South Africa, were agreed with the Ministry of Health and the district health offices, and these were a mix of primary healthcare facilities and hospitals. Health4Afrika functionality, user interface, and supportive programs have evolved over a significant number of years. User requirements and input have also evolved in sophistication as participating stakeholders realise what has been achieved to date and expectations increase accordingly. DHIS2 is used as the National Health Management Information System for monthly aggregate health data in most ACP group countries, including Kenya, Malawi, and South Africa, and as a result of participation in Health4Afrika, Ethiopia transitioned to use DHIS2 as the HMIS. One of the technical research objectives for Health4Afrika was to research whether a comprehensive, extensible, patient-centric, multi-program health platform could be built on top of DHIS2. The platform incorporates a number of components. So the Health4Afrika data model, which is configured for 12 medical programs, a custom application and UI that interacts with the data model through a web API, HL7 Fire service, and this was a design requirement to support standards-based data exchange. So we developed HL7 services in 2017 to address 3 use cases: medical sensor data from Android Windows applications to be transferred to the electronic medical record, transfer of lab requests to a laboratory system, and when the results are available, transferred back to update the electronic patient record, and the ability to import and export individual patient healthcare records to support referrals and mobility. We also developed an Android application to display readings from CE-approved Bluetooth sensors and a Windows application to display readings from a USB sensor, HemoQ. While we initially focused on maternal and child health, once these programs had been successfully implemented, stakeholders strongly encouraged us to extend functionality and program supports to provide a comprehensive and integrated solution that will facilitate a holistic cradle-to-grave approach to patient care. Health4Afrika incorporates an extensive set of programs and functionality. So the programs include medical history, maternal health, family planning, cervical cancer screening, child under 5, tuberculosis, ART, diabetes, and outpatient. In terms of sensors, we introduced the use of sensors at the point of care to capture readings based on pulse rate, blood oxygen levels, blood pressure, blood sugar levels, temperature, weight, and hemoglobin. So the nurse takes the reading, and then these readings are passed within the Android application via Bluetooth. So here we can see the interface of the Android application. So when the nurse puts the sensor on the patient's finger, they can see the reading. The reading is passed to the Android application, and the patient and the nurse can see the reading, and they can see if it's in a normal range or if it's outside the normal range. It interacts with the data model. There's user authentication both to access patient records and to pass patient records to the electronic medical record. It synchronizes and retrieves the patient list. It displays the sensor readings using Bluetooth LE, and it passes the sensor reading to the patient electronic record using HL7 Fire. So now we're going to look at some of the patient-related functionality. Come to the patient list. They can filter the patient list based on the programs that they have access to, and the clinic manager determines which program each system user has access to. So they can filter or they can search for part of a name. Now we're going to look at some of the programs. So here, this Pacific lady is set up
as part of the maternal program. You can also see that she's registered for family planning, cervical cancer screening, and medical history. Here we've kept a similar block approach on each of the program pages. So it's a dashboard that provides you access to the patient information, the stages and the reports, appointments, and then visualization of data, including vital signs. So here we can see that this lady has been set up for all the appointments across the maternal health program, and she has attended most of the appointments. Here we get an overview of the patient, so we see the LMP, the EDD, and the number of previous babies. We have access to the stages. So for each stage, we can add data. So we can add a pregnancy test, then we add each of the ANC stages, delivery and postnatal, and then to access these stages that are complete, we just click on the name of the stage. Here we have access to visualization of the data that was collected during the stages. So the blood pressure across the 8 ANCs and postnatal, temperature, then weight, abdominal circumference, SpO2 and pulse, and fundal height. So this gives the nurse a good overview of the development of the patient's condition across the pregnancy. We'll now look at another program. So here we have a child. So this child has attended all of the visits across the 5-year period. We have access to the latest growth and nutrition details based on the last visit, a summary of the immunization that they received. And then when we click on stages, we see all of the data that was input. So at birth consultation, each of the growth and nutrition visits, consultations or childhood illnesses, immunization visits, vitamin A and deworming. And then we have access to data visualization for across the visits. So in the case of the Child Under 5 program, we've set up visualizations based on the WHO graphs. So this shows you the reading for weight for age against the Z scores, the weight for height, length for age, and we've also added the MUC. This patient is registered for ART. So here we see the appointments that he's registered for. We see an overview of the risk factors that have been captured during his interactions with the health centre. We have an overview of the latest vital signs based on the last reading and the summary of his treatment as part of the ART programme. We can access the stages, so we can add a pre-ART or a voluntary ART consultation and then regular ART consultations. We have access to reports that give us the analysis across the different visits, and we have data visualization for blood pressure, temperature and weight. Then we also map CD4 results and the viral load results. So this allows the nurse to monitor progress.
So this gives us a brief insight into some of the functionality. So valuable lessons were learned from both a process and an implementation perspective based on using different technical configurations. So Health4Afrika adopted a strategic approach to addressing the needs of resource-constrained intervention health facilities in different social and physical locations. The objective was to gain true insight into challenging resource-constrained environments, reflecting where this platform could be adopted by healthcare professionals around the world. We identified and experienced and addressed a number of practical implementation and adaptation challenges related to infrastructure, digital literacy skills, technologies, standards, and interoperability. And another key challenge to the adoption of electronic patient records is access to reliable power, which can be problematic even where clinics have access to power. So this learning curve helped us to identify processes and procedures, solutions and good practices that we could build upon when collaborating with policymakers, practitioners, and technologists to adopt Health4Afrika to other resource-constrained environments. So in terms of infrastructure, the initial intervention health facilities did not have existing computer technology on which to validate the Health4Afrika platform during the pilot phases. So as part of the needs requirements, the basic hardware required was identified. So we selected a laptop based on having the key benefit of available battery power, tablets to be used for data collection and search at the point of care, and a Wi-Fi router to support data exchange between the devices used at the point of care and the server hosting the database. Given that many of the intervention healthcare facilities had either sporadic or unpredictable electrification challenges, this was why we decided that a high specification laptop was more practical instead of a traditional desktop computer that's normally used in a healthcare environment. While we started by implementing Wi-Fi networks, the building construction methods in the facilities, being concrete blocks, metal doors, metal roofs, and bars over the window, required Cat5 or Cat6 based physical LANs. And based on the progress achieved in a number of initial intervention healthcare facilities in Kenya, the Ministry of Health and Sanitation, Bungoma County, provided permission for Health4Afrika to be deployed in a significant number of health facilities, so district hospitals and primary healthcare facilities, which had access to server thin client infrastructures. And this provided an important opportunity to investigate the potential strengths and weaknesses of deploying Health4Afrika using different kinds of infrastructure. Valuable lessons were learned from both a process and an implementation perspective. The tablets were provided initially as a capture device to support vital signs from CE-approved medical sensors. However, we found that the usability of the tablets for data collection and access had mixed results, in part due to the relatively weak Wi-Fi chips in the tablets and the signal in the facilities. The platform was tested on both Linux and Windows operating systems. Then in terms of digital literacy, while setting up the initial technical infrastructure in the intervention facilities, digital literacy training was undertaken with clinical staff around their clinical needs. It was very clear from a baseline study that this training needed to focus on how to use laptops and tablets and becoming familiar using a computer keyboard and a touch screen. Bluetooth keyboards were provided for use with the tablets. So valuable lessons were learned during the initial digital literacy training, which informed how we would approach digital literacy training in new intervention sites going forward to encourage self-directed learning while staff are not working. So we installed typing programs on the local server to complement small group and individual digital literacy training provided. And certificates were provided to those who completed the digital literacy and platform training. In terms of technologies, one of the research objectives was to co-design a comprehensive patient record framework for healthcare facilities that interfaced with DHIS2, which is used as the national back-end health information management system for routine reporting of monthly aggregate data in many African countries. So Health4Afrika developed a custom application and user interfacing using Angular JavaScript to interact with the Health4Afrika data model set up in DHIS2 as a web API. The application was designed to render the UI based on the data model, which allowed additional medical services to be added iteratively without additional coding. And then in terms of standards, we took a standards-based approach to data interoperability to support data exchange between applications and systems, taking account of national policies and legislation in the intervention countries, as well as the most up-to-date standards. Then in terms of methodological perspective, we applied a mixed method strategy. So to inform the platform development, design science research techniques were applied whereby the problem was identified, the artifact requirements defined, and the artifact designed, developed, demonstrated, and evaluated. So each platform iteration used an agile development process. This supported regular interaction with policymakers, district health offices, facility managers, and healthcare workers as part of an iterative co-design process to validate each version and prioritize functionality, UI, and data sets, requiring further adaptation to successfully implement subsequent iterations. And a key strength of our methodology is the focus on co-designing a multi-country proof of concept. When carrying out pilots or adaptation for new countries, a highly structured and comprehensive needs assessment and baseline study are highly recommended. And this will provide the necessary insight into national protocols, clinical workflow and reporting requirements, as well as environmental and socio-cultural norms within which the platform will be used. All too often, mHealth and eHealth projects have followed an approach of technology push. Adopting co-design and an agile development process facilitates responsiveness to stakeholder inputs based on an active stakeholder engagement. This approach can potentially take more time, but supports the ability to respond quickly to requirements in real-life environments. And then in terms of human factors, health systems can only be taken up and become sustainable if the staff treating patients can capture electronically the data captured by paper-based registries in the same amount of time or less. This requires a clear identification of skills gaps, appropriate digital literacy, and platform-specific training to be put in place alongside change management. And it's critical that ministries of health and facility management support this aspect and release healthcare workers to participate in the skills programme. One of the key challenges supporting health-related technology adoption at the base of the pyramid is the limited number of health personnel and relatively large catchment areas being served. So we utilised data entry personnel to help to speed up the process of running paper registries in parallel with electronic records. So in terms of achievements, Health4Afrika has developed a state-of-the-art, patient-centric health information system designed to improve primary healthcare delivery in resource-constrained environments, which works both online and offline. It was co-designed and validated with ministries of health, district health offices, and clinicians in Ethiopia, Kenya, Malawi, and South Africa, in a mix of hospitals and primary healthcare facilities with a catchment population of approximately 875,000. And a wide range of medical programs were configured based on analysis of paper-based systems and inputs from clinicians to maximize the use of the EMR. And in terms of next steps, we wish to validate the system functionality and programs with health facilities in countries not involved in the initial co-design process, and we're looking for support to scale the implementation in existing beneficiary countries and new countries. So here you have a link to a video showing functionality and user experiences.